Chances are pretty high that you have this drug somewhere in your house. I mean, it's one of the most common, most trusted over-the-counter pain and fever relievers on the entire planet. But today, we're going to pull back the curtain and explain the hidden danger of acetaminophen. Okay, let's just jump right in with a quick question. What do you think is the single biggest cause of sudden, severe liver failure in places like the US and Europe? Maybe your first thought is alcohol or some kind of rare virus. Well, the answer, and this might surprise you, is acetaminophen. Yep, the exact same medicine you find in Tylenol and countless other cold and flu products. Now, what's really fascinating is how this all happens. It's not that acetaminophen is inherently a poison. It's that taking too much pushes your body past a critical, dangerous tipping point. And that brings us to the single most important factor in this whole story, the dose. You see, with acetaminophen, the line between a safe, helpful amount and a toxic, life-threatening one is actually a lot narrower than most of us realize. So for a typical adult, serious toxicity becomes a real risk when the total amount taken goes over 12 grams in a 24-hour period. To put that into perspective, one extra strength pill is usually 500 milligrams. That means we're talking about 24 of those pills in a single day. Now that sounds like a lot, but it can happen accidentally, especially if someone's really sick and they're taking multiple different cold and flu remedies without realizing they all have acetaminophen in them. For a single ingestion, like if someone takes a bunch of pills at once, the toxic dose is about 150 milligrams per kilogram of body weight. And this is especially critically important for children, where their dose has to be calculated perfectly. So for, say, a 44-pound kid, that's about 20 kilograms, the toxic dose could be as little as 3 grams. That's just 6 extra strength pills. It's a pretty stark reminder of why you can't guess with kids' medicine.
So what is actually going on inside the body when someone takes too much? Let's break it down. I think the easiest way is to think of it like a story, a battle between a hero and a villain that's happening right inside your liver.
First up, let's meet the hero of our story, glutathione. You can think of it as your liver's own personal security team. It's this really powerful antioxidant that your body makes all on its own. And its whole job is to find harmful stuff, neutralize it, and keep your liver cells safe and sound. And now, for the villain. It's a toxic molecule with a very long name, N-acetyl P-benzoquinone, but we'll just call it NAPQI. Now, when you take a normal dose of acetaminophen, your body makes a tiny, manageable amount of this stuff. It's really no big deal. Your glutathione security team just swoops in and takes care of it. But in an overdose? Oh, the story changes completely. So let's walk through exactly how an overdose unleashes this villain. It all happens in this devastating 4-step chain reaction. Okay, step 1. Your liver has these safe, main, highway metabolic pathways to process acetaminophen. But an overdose is like a sudden, massive traffic jam at rush hour. These main routes just get completely gridlocked, totally overwhelmed by the sheer amount of the drug trying to get through. Step 2. So with the main highways totally backed up, your body is forced to divert all that extra acetaminophen down a metabolic side street. The problem is this little side road is a factory for our villain, NAPQI. And all of a sudden your liver is just flooded with this incredibly toxic compound. Step 3. Your liver mounts this desperate defense. It sends out every single glutathione bodyguard it has to try and neutralize the threat. But it's just a losing battle. The army of NAPQ is way too big, and the body's entire supply of this crucial protector gets completely wiped out. And that brings us to the final step, step 4. The bodyguards are gone. The liver cells are now totally defenseless, and NAPQ starts attacking them directly, causing widespread cell death. This is the molecular event that leads straight to acute liver failure. So you see, the problem isn't just the drug itself. It's that the drug destroys your body's own natural ability to defend itself. Now, what makes this whole thing even more treacherous is how the symptoms show up, or rather, how they don't show up. It's not an immediate crisis. It's a silent, really deceptive timeline that can fool both patients and even doctors if they're not careful. Clinically, we break down the progression into 4 pretty distinct phases, and understanding this timeline is absolutely critical because effective treatment is, quite literally, a race against the clock. So for the first 24 hours after an overdose, the symptoms are incredibly vague. We're talking maybe some nausea, a little vomiting, just feeling kind of blah. It is so easy to mistake this for the flu or just a stomach bug. And during this whole phase, the person often has absolutely no idea they're in any serious danger. Then comes what might be the most dangerous part of this whole timeline, SAYS 2. Between 24 and 48 hours in, that initial nausea might actually fade away. The person might even start to feel better. But this is just a cruel trick. Internally, the liver is under a massive, escalating attack, and blood tests would show clear, screaming evidence of accelerating damage. Then, after 48 hours, we hit phase 3. This is when the true severe symptoms of liver failure finally rear their ugly head. Things like yellowing of the skin or jaundice, confusion, severe belly pain. But the tragedy is, by the time these symptoms are obvious, the liver has already sustained massive damage, and the situation is now a life-threatening emergency. But there is hope. If this poisoning is caught early enough, there is a highly effective antidote. This is where the medical rescue crew comes charging in. And this antidote is incredibly effective. But to really get how it works, we need to put the problem right next to the solution. Okay, so remember, the problem is that your army of glutathione bodyguards has been completely wiped out by that NAPQI invasion. The solution is an antidote called N-acetylcysteine, or just NAC. And it doesn't fight the NAPQI villain directly. No, it does something way more clever. It rapidly resupplies your liver with the building blocks it needs to create a whole new army of glutathione, essentially rearming your natural defenses so they can finish the job. And this all brings us to the single most important message when it comes to treatment, which is captured perfectly right here. The time between taking the drug and getting the antidote is directly, and I mean directly, linked to the outcome. The sooner treatment starts, the better the chance of a full recovery, plain and simple. Okay, so let's boil all of this down. What are the key practical things you need to know to make sure you're using this super common medication as safely as possible? First, always read the active ingredients on the labels of everything you take, especially those multi-symptom cold and flu products. It is shockingly easy to double dose by accident. Know the maximum daily dose, and never, ever estimate a child's dose. It has to be based on their weight. And maybe most important of all, if you even suspect an overdose in yourself or someone else, do not wait for symptoms to show up. Get to an emergency room immediately. And be sure to tell them exactly what was taken, and this is crucial, when it was taken. That one piece of information could literally save a life. And that just leaves us with one final question for you. Next time you have a minute, go take a look in your own medicine cabinet. Do you know for sure which products in there contain acetaminophen and how much? Knowing the answer could be one of the most important things you do for your health today. Thanks for joining us.